Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So I've just done what is a complete end block, 4225, initials JO, nice lady. So her story is she had initial set of implants 1983, silicone. And she ended up in 2024, almost 40 years later, 41 years later, ended up getting them replaced, and at that time both of these implants were noted to be ruptured. The right one was malpositioned, so the doctor used what is proline suture in order to secure. So this current set is from 2024. Right after she got her 1983 implant, she got capsular contracture, and so as you can see, look, this is a year old implant, and you can see, look at the outpouching right here, look at this bulge here, look at another bulge, and there's a lot of inflammation tissue. So for this case, the goal is to remove the implant capsule, but remember that ruptured silicone was bathing the entire chest area, and so for that reason I cleaned out all this inflamed tissue into which that silicone had embedded within and incorporated. You can see these irregularities that are present now. This is a year-old implant. Very unlikely it's ruptured, but you can see the capsular contracture, how it's conforming the implant into this face. Done and block, the gold standard. So I'm going to go ahead and cut this open, and I'm also, because I have the operative note from 2024, it says they used proline suture, so I was on the lookout for that as well, and I did indeed encounter it. So as I go in, you can see how hard and thick this is. I just want to go ahead and show, look how inflamed this tissue is. And I am having a hard time just cutting through it. And so if you ask me, there is suggestion grossly of what is silicone granuloma. Again, we will see what the pathology shows, but it is hard. It is, I'm having a hard time dissecting. So this tissue has to go as much as the capsule. So I'll be, so I'm going to go in here. Remember, this implant is just a year old, impossible for it to be ruptured. Small implant. So you can see how thin the capsule is. You can actually, you remain exactly where you are. Hey doc, can you go ahead and turn my headlight off? Please continue. And turn my headlight off. I just wanted to turn my headlight off. So as you can see right here, this capsular tissue is so thin. I'm actually going to take the ruler. If I put it here, you can see how thin this is, right? No matter what, it has to go. And as I dissect, I incorporated the inflamed tissue. So this is your mentor implant. And as you can see how it's sitting, kind of suffocated, compressed. All done and block. And if I go, there's some fluid around. You can see that stickiness. That's what is suggestive of a gel bead. So Mentor 200 in brand new condition, relatively small implant. And as I go in, you will see, look how thin this area of the capsule is. And I'm looking for my proline suture, which is a permanent suture. So I'm going to go ahead and dissect. Very thick, as you can imagine. So there it is. There's your proline suture embedded within. This is what the doctor used, and the eyes don't see what the mind doesn't know. So I'm going to dissect this out. It's going to go with the specimen, but what I want to show you is and look how hard it is. I'm having the hardest time with these very sharp scissors to dissecting it out. This was used to anchor. Let me go in here. You can see the suture literally was run in a continuous fashion in order to secure that pocket so the implant would not fall down. So here's that suture. And always is good to get that up note. So here's that suture sticking out. So this is the right breast implant capsule, relatively very thick, inflamed. And so we'll see what the pathologist says. And then I want to go ahead and show you here. This is the inflamed tissue around. Angry, inflamed, irritated, what is not normal by palpation, visualization, my sixth sense. Because I feel in my mind this is where that inflamed tissue from the history of that silicone spill, this needs to be removed as much as the capsule. Now I'm going to remove my top glove, so I have a sterile green glove underneath for the left side. And again, as you will see, look at this irregularity here, all the way around. I removed the tissue that was abnormal because the history of that silicone spillage was all in the periphery, so I want to incorporate all that tissue. You can see this is the implant. There we go. Some areas thin, some areas thick, but all of that bad tissue has been removed. And we can see how this was sitting en bloc. You can see that stickiness right here. 200 mentor, just like the op note said, in brand new condition. Capsular tissue that's very, very thick. Look at this dark pigmented area right here. So we'll see what the pathologist is going to show. Look at this. It has some look at this. I'm actually going to take cultures of this. This is a tissue right here. It is like muddy. It has a muddy brown consistency. So we're going to get cultures of this. See, look at this tissue right here. See right here, look at this. It's like dirt. So I'm going to take cultures of this. And remember, the pathologist is going to get this representative sample. And this is where I've not left any of this behind. Look at this one, look at this. And we'll see what they say. If there was any fluid, it was all contained because this was the en bloc, Now what I'm going to do is continue to do with this. I'm going to change my gloves because I don't want to contaminate that into this. So you want to separate at any given time and not cross-contaminate. That's why sterile gloves are key. And so that is that left chest mass, that's the inflamed tissue, angry, irritated, inflamed, did not palpate right, did not feel right, my gut said it needs to be removed. So we give her the best chance for her heal. And you can see this is all abnormal, it's nodular, it's hard. And so I'm going to send this off to pathology, all of this as a left chest mass as labeled here. So the implants will be returned to the patient. Capsules will be sent to pathology, rule out BIL, CL, CD30 analysis, cultures for aerobic, anaerobic, and fungal. I'm certainly going to take a representative sample of that black-brown slimy material, and then right and left chest mass, respectively, to be sent to pathology. And overall, I'm very happy and content with how the whole surgery went. En bloc, the gold standard. She got a complete clean out. She's going to get pictures and videos of her chest wall showing that complete clean out, and so that she will have complete transparency as to the nature of the surgery, the indication for the surgery, and that as she heads back to the Northeast, she will have that peace of mind and content that everything was removed, and number two, everything was tested so that she has the peace of mind it was not that rare lymphoma or any bacterial or fungal issues, anything like that.